I'd like to first introduce our discussion panel. We've got Johnny Pullman to my left. He's a team leader at Sutherland Community Mental Health Service. We have Sue Martin, and I want to particularly thank you very much for coming along. Sue is a client of Sutherland Mental Health Service. And we have Leonie Dunn, who's the Rehabilitation Coordinator for Sutherland St George Mental Health Service. So we have two innovations that we wanted to briefly talk to you about. The first one is the St George Sutherland Mental Health Service Strengths Model. And I wanted to direct this question to Johnny. Firstly, Johnny, could you briefly outline how mental health services have been historically delivered?
In an Australian or a Western context, we've tended to look at deficits and symptoms as our starting place. And allied to that's also been, allied to that has also been the kind of idea that somehow people with mental health issues might be a bit safer if they weren't fully a part of the community and kept aside. And probably the old asylum psychiatry hospitals is the single greatest example of that. But that kind of culture tended to creep through our whole system, I think. So that's historically. In the last 25, 30 years, and it's nice actually from the ground floor to hear the ministers allude to this. We've really learnt that that's not the best way of doing things. There's been a lot of research, particularly by like the World Health Organisation as a body, done a lot of research to show that actually in countries, cultures, places where people that experienced illness are kept within the cultural context, kept within families, kept within the jobs, kept within the places they live, they do better. And that's been a part of the kind of the movement towards understanding recovery is where we need to go. And what the strengths model is for us is a way of kind of operationalising that different way of thinking in our context.
So perhaps you could just progress that discussion a little further and just explain the strengths model that's been implemented across Sutherland St George Mental Health Service.
For sure. Very quickly, we're working now from 6 principles, and the first one is that everybody that experiences an illness or a disorder has the potential, the capacity to recover. So it's got this optimistic starting place. The second is that we start by looking for the strengths that people have, and that can be things that are inherent to the person that they have or felt that they used to have and forgotten about. But also it's the strengths around them. It's the strengths of the community, it's the strengths of you folk, the strengths of people's families. We look for those things as the building blocks to work from. Third thing is that we really want to see the community as an oasis of support rather than something to be slightly afraid of. The fourth thing, and very central to this model, is that the client directs the process. We want to know our clients, we want to know them as individuals, as people. What are their dreams, what are their aspirations? Because if we work with that, we all get a better result. Alongside that, the fifth principle is that we talk about the working relationship between the clinician and the client as being primary and essential. We can't get away from the fact this is relational work, and it's about us stepping out of being an expert and becoming a collaborator. And again, if we take that stance, we just get better results for people. The sixth one, and it ties to number 3, is that we want to do our work in the community. If that's the oasis, if that's where the recovery comes, we need to sort of have our services pointed out into the community rather than back into our own buildings.
Thanks, Johnny. You explained that very well, and I've been following on the overhead, and you covered those 6 points very well. Well done. There you go. Sue's story. Welcome, Sue, and I wanted to thank you particularly as a consumer of our service for coming along and having the courage to share your story with us. So I just wanted to ask you, can you tell us or tell the audience a little bit about your experience with the mental health service over the years and the difference that the application of the strengths model has made in your life? We'll just hold that up, Dom.
I was a registered nurse and I first became unwell in 1996, and my whole life felt like it had fallen apart. Treatment then was focused on medication and symptom reduction, not me as a person. I struggled for 10 years, and in 1996 I relapsed and had 10 hospital admissions in 10 years, ranging from 6 weeks to 3 months, which was a huge hunk of my life. Life became empty. I felt I became my illness, and I came close to losing my life. The difference Strengths has made is this is focused on past and present strengths, which I'd forgotten about or I didn't know I had. We all have them. I was asked for the first time what I really wanted out of life. I needed to make decisions on my life and its directions. I was given hope and help and confidence every step of the way by the clinicians that had actually done the strengths training to reach my goals. It gave me control over my life and it eventually gave me a life back worth living. A relationship of trust developed with the clinicians. And it actually just changed everything around. I now work 4 days a week, and by the end of this year I'll be back in my original profession as a registered nurse. I have an active social life and I'm no longer a burden to my family or society.
Thank you very much, Sue. Linked very closely to the strengths model is our second initiative, and that is the employment initiative, and Leonie's going to assist us with some discussion around this topic. So under the question of why focus on employment, Leonie, can you explain to the audience why this initiative focuses on assisting people with a mental illness to gain employment? Why was that identified as a priority, helping mental health patients to gain employment?
As we know, people with a mental illness have a much higher rate of unemployment than the general public. That roughly the rates are 75% versus 5%. And we also know that people with a mental illness face major challenges in getting a job and keeping a job. And we also know that people with a mental illness want to work. And so, as we've heard today with various people speaking, we're also aware of the positive benefits that employment can have on a person's recovery from mental illness. So as a mental health service, it's really vital that we help people in any way we can to get back to work.
Excellent, thank you. So can you tell us a little more about the employment initiative that was implemented in St George and Sutherland?
Sure. The Employment Initiative is a program where we've co-located an employment consultant from a disability employment service with the mental health team in St George, and in this case it's Catholic Cares Direct Employment. And having the employment consultant located within the mental health service means better communication and coordination between the services to help people to get a job and actually keep that job.
Okay. The individual placement and support model, that's what it's titled. Can you tell us a little bit more about what that means, individual placement and support model?
So this is the model that the co-location initiative is based on, and it's an evidence-based model which has been shown to be 2 to 3 times more effective than other models in helping people who have long-term mental illness gain a job and keep that job. So the main principles of this model were going to be on the slide behind me. So there's a number of key principles that both our services really work hard at keeping to ensure that the model works as effectively as possible. But the key to this model is the co-location of the two services and helping people to gain a job in competitive employment or open employment of their choice on an award wage.
Yep, look, that's so good. See, we tested Leonie's memory and she's remembered that all without the help of the slide. So those key thoughts around, personal choice and competitive employment, that honours the individual, doesn't it? Yeah.
Exactly.
So what about outcomes? What have been the results of the initiative? It's been going about 12 months. How have we gone?
12 months, and I just wanted to add that the employment consultant's caseload is capped at 20 to ensure that they are able to provide the amount of support required. So far we've had 24 clients have been through the program and 12 people have gained employment during this time, which is fantastic. And the types of jobs are varied, including factory hand, carpet layer, cleaner, legal secretary, etc.
Good.
So, yeah.
And just finally, can you share with us the personal experience of one of our
Yes.
clients who's given us permission to talk about
Sure.
his case?
Yeah. So this is the most important reason that we're doing these sorts of initiatives, and I'll just read out his story in his words. So I'm 35 years of age and have a diagnosis of schizophrenia since I was 22. I'd been with other employment services in the past and had been looking for a job for over a year, but had not stayed in a job for more than a few days and was feeling really down about this and frustrated. My case manager from mental health referred me to the employment consultant in January this year, and the employment consultant saw me a lot and helped me with cold canvassing, calling employers, dropping off my resume and practicing for interviews. We looked for a driving job, which is what I always wanted to do. Now I've been working for almost 3 months as a valet driver and I really like it. I work 5 days a fortnight. I can call the employment consultant if I need to and she helps me. And I saw her every week at the beginning, but now I see her fortnightly. She comes to my work or I see her at the mental health service. Since I've been working, I feel a lot better. I have money in my pocket to be independent and do what I want. It's better than just the Centrelink benefits. I feel happier and I like having a job to go to. I'm busy and my family is happy now. So that's what the employment initiative is all about.
Yeah. So we're delighted to present those 2 initiatives very briefly to you as an audience. For us as staff of the Mental Health Service, it gives us real satisfaction in making a difference in people's lives, and we're really happy to be given the opportunity to share that with you today. Thank you.